Hello, everybody on Zoom and FB with us. We are now hopefully streaming live in the Facebook group. So welcome in. It is night 3 and we're super happy that you're here. And at the end of this, if you guys want to come off mute and come on camera, by all means, don't hesitate, especially when if David joins us tonight. You will absolutely love to pick his brain. And I'm hoping he'll be joining us as well. Jackie, I'm glad you made it in. Yay. Kaylee's here. We have all the wonderful people here. So welcome in, you guys. If you're on with us in Facebook, say #live, and I'm going to go ahead and get us up, hopefully, and running. Okay, awesome. All right. So I had a couple little questions, just 2 questions to get us kind of warmed up from yesterday. Also, right after these questions, I'm going to do our drawing for our prizes from last night, as usual. So excited about that. And #live, yay, I know, Jackie, thanks for letting us know that you were having issues so we could get you that link. No problem at all. So right after we do the questions, we'll jump into the prizes. Okay, so how many boxes? I don't think we covered this yet, but let's talk about STEMI really fast. Okay, so STEMI, as you know, we have to have elevation in 2 contiguous leads and depression and reciprocal, ST depression and reciprocal changes. Okay, so for everything except for V2 and V3, how much ST elevation do we need? Is it any, is it 0.5, or is it 1 small box? And this is actually something we haven't covered yet. It's a little bonus tidbit. So with actually STEMI, we need to have, and maybe none of you knew this yet, so this is great, we're helping you learn. So in lead 3, we only need to have 1 box of ST elevation for it to be clinically significant, okay? And number 2 question, how big is a pathologic Q wave? And we covered this on night 1, so I decided to bring it up tonight for a little bit of a party. How big is a pathologic Q wave? So we'll take a couple answers for this. But how big? Ah, good, Yu Chun Lee, yes. Okay, so we have some answers on Zoom. Okay, no worries. No worries. Okay, so actually, how big is a pathologic Q? 1/3 the height of the QRS. Yes, Vanessa, nice job, strong work. And I believe, is David on with us in the Zoom world yet? I don't. There he is. Yeah, he's here. You guys, I'm so excited. So we'll make David co-host so we can see him. And while David's getting up and running, I'm going to go ahead and do our drawing. Okay, so we're actually giving away this delicious RCAT tool here. It has all the arrhythmias, goes right in your pocket, folds up, comes with a badge too. So this is going to be our first drawing. So I'm going to open my box. Last night you guys put in that you wanted to be winners, so I put your name in the box. So our winner of the RCAT arrhythmias is Amanda Lois. Amanda Lois or Louise. So you are the winner of the RCAT arrhythmias. And we also have a winner of the badge. So the winner of the badge is Shini Parambath. Shini P. I couldn't write your whole name on here, but congratulations to our winners. Don't worry, we are going to have more winners tonight. And honestly, you guys are all winners because not only do we have David on tonight, but we also have Gary coming on after. So David, welcome in. Do you want to say hi to everybody?
Hey guys, I'm David. Jen's really bad about a big hype, and it's not quite that hype. I'm a paramedic in the Atlanta area. Really big EKG nerd. So if you guys got EKG questions, put them out there, and we can we'll go over them.
All right, awesome. So yeah, actually, David is, and I think we have Michelle too. Michelle, do you want to come off mute and say hi too? Because it's rare that we actually have you guys both on one screen together. So Michelle, want to say hi again to everybody?
Yes. Hey guys. Just saying hi on day 3. Day 3. Whoa, I forgot which day we're on. I am making game questions for Thursday night. So get ready because we are going to play EKG Millionaire game, so you can get 1,000,000 points and maybe even some more prizes. So keep in mind.
Okay, see, you guys are so hashtag blessed to have all these wonderful coaches here. Michelle and David actually teach in our 30-day EKG challenge. And so they have been with us in the 5-day and the 30-day for over 2 years now. And I know David is very modest, but he really is an amazing teacher. And Michelle is too. We're just really lucky to have them both here. So we're going to talk about day 3 and the fact that David, when you were in the comments last night, I saw you put a comment that just really touched my heart. You said, we were all at that one place one time when we didn't know how to read EKGs. And I was hoping that, we have a lot of baby Yodas here, and I was hoping that you would share with us kind of your experience when you first started reading EKGs, what that was like for you.
Oh, sure. When I went through school, I had a really good cardiology teacher. We learned lead 2 interpretation really, really good. But then towards the end, we got 1 hour of 12 lead training. Basically, it was STEMI criteria, and out the door we went. So for a very long time, I relied heavily on the computer interpretation. And then you come to find out it's wrong so many times. I was calling STEMI alerts and all kinds of things just left and right. Completely wrong, had no idea what I was doing. It was really just guessing in the dark. There was really nothing out there like there is now with this group, where there's a support group where we can help each other learn some of the basics, the intermediate and the more advanced stuff. So I spent years going through reading everything I could get a hold of. A lot of books, found everybody out there to get good at it. So nobody actually had anything like this for me when I came along. I had to like piecemeal it from here and there and books and articles and everything. But it took a long time, and it's EKGs are not easy. It takes a long time to get good at this.
Amen. And so with that, we kind of have, we call David the Mandalorian. So if you're familiar with Baby Yoda and the Mandalorian show, then you know the Mandalorian is the one that protects Baby Yoda. One of my favorite shows personally, which is why. Yeah, so Michelle actually said, David, can you suggest any specific books for newbies? I know Michelle is a teacher as well, so.
So books, one of my favorite was Tomas Garcia. What is it? The Art of 12 Lead Interpretation. I think he's got 4 or 5 editions out. Any of those are good, really good. If you go on Dr. Ken Grauer on his website, he's got links to all of his books. He's got basics all the way up to super advanced. He's probably the most advanced guy there is, in my view. To me, he's got like X-ray vision with EKGs. So I've mentored my style of interpretation after him. But he's got a lot of really good books at the more basic level. So anything from him, Life in the Fast Lane online, really great snapshot, really quick answers, very concise. They spell everything funny because they're in Australia, so don't worry about that. And another probably more advanced site would be Dr. Smith. He's the one that fixed Scarbosa criteria. And anything from you can go on YouTube and get anything from Dr. Amoma too. So those are kind of my go-tos.
Yeah, those are all good recommendations. So speaking of things that we were covering yesterday, we actually talked about this yesterday. We talked about Wolff Parkinson's White, and you've got the mnemonic. And so I wanted you to write these on the lines, right? Wide wave, QRS, PR interval under 120, and the delta wave. And I pointed it out for you here. And so you could practice on your workbook page. So that's the answers. And we did post that in the group this morning for you if you are following along with that. If you still need a workbook, no problem. Put hashtag workbook and Tori will get that out to you ASAP. All right, now we're going to talk about tonight's case, and luckily we do have the wonderful coaches here to also help me with this. And if you guys have questions, let us know. But this is literally what one of the things that happened to me that scarred me for life, that made me afraid enough to go get better EKGs. I had a nurse that was standing in the hallway and yelled, "You missed something," in front of everyone. I was mortified. Hopefully you haven't had an experience like that, right? But that was enough to motivate me even more to just dive in deep and really make sure I never got yelled at again. And so I deep dived into the high risk patterns, and this is one of them. So we're going to talk about this pattern tonight. Now, this is a urgent care. We'll pretend this is not a real patient's face, but we'll pretend that this is a 17-year-old male named Kevin. And Kevin, you know, doorway diagnosis. David, do you use doorway diagnosis when you go in and examine patients?
Yeah, that's one of my clues to big sick, little sick. So that's even before I get an EKG, just the across the room appearance of the patient, how they appear, really plays a factor in, because it's more than EKG interpretation. It's just a tool. But yeah, looking at the presentation of the patient, how uncomfortable they are, diaphoresis, things like that, we put that with the EKG, and then we can really get a complete picture.
Absolutely. So his doorway diagnosis so far looks pretty good. He's kind of got a little smirk. And here you can see that, oh yeah, he has a positive text sign. So he's looking pretty good. Mom says, yeah, you know, I just want to be safe. So I brought him into urgent care here, and we did some vitals, no history. And of course, Mom says, will this be long? And of course, to which you reply, well, you know, let's do an EKG, right? Let's see what's going on. Now, positive text sign is something that I'll use loosely with coworkers to tell them, oh, the patient's fine. There's also, if the patient's asking for a turkey sandwich, that's another indicator that they're probably fine. So turkey sandwich sign, positive text sign, although I have seen a kidney stone patient, even in severe pain, text. So we can't always use the positive text sign. PS, don't ever document that. It's not a real thing, but it's just a way to see if someone's super sick. So he looks good, but there's some red flags in his history. So David, when you had teenage boys, how often would they, well, their mom is cool, but let's just, how often did they call mom at school, like to come get them?
My kids, no. My
No.
kids, no. They called me once when they in wood shop where they run a chisel in their hand. That was it.
Okay.
They didn't call
Yeah.
mom.
So your kids were probably super tough also. But you know, for a young teen to call their mom and pick them up, it's a red flag for me. And if a teen says, unless they're having a complete, you know, meltdown, anxiety attack, if they say they feel like they're going to die, that's also something that's a red flag for me. So the other thing that's super huge is their uncle died of something wrong with their heart at age 36. So David, when you hear that, what do you think of?
That's that close family history of sudden cardiac arrest at that age, that makes me really, that makes the hairs on the back of my neck stand up. I'm really paying attention, and I'm gonna the 12 lead, I'm gonna scrutinize probably a little extra more than I would just a normal chest pain or something.
Yeah, ditto. And you know, I just watched, speaking of Amama too, I just watched a talk he did recently about young people having heart disease, and he polled the audience and he said, hey, what's the youngest STEMI you've seen? And someone said 17. You know, there was a lot of young, and this is in our country. And the reality is that yes, there can be congenital things, but there can also actually be heart disease. So David and I have this thing where you look at their chronological age, not their actual age, right? So even this kid who looks good can have something really wrong. So of course we're going to do an EKG. And this is Remy. Remy says he wants to show you the EKG. So here it is. All right. And so the read is not telling you the big bad wolf that's going on. And as David will tell you, David, how do you think about the read of the EKG? What do you usually say about it?
Oh, well, my partners, because I work in EMS, when the EKG prints out, my partner just tears that, because mine's side by side. we get the interpretation, and then the 12 lead comes out side by side. They just tear it off and hand me the actual tracing. They don't actually give. If I wanted to go look at the computer interpretation, I'd have to go back in the trash and unravel it because I just don't use it. I found that every single cardiac machine monitor interpretation that I've ever seen or used, they're wrong, probably in the 50% range. So I don't rely on it, period. Looking at this one, normal, incomplete right bundle. So I see wrong, possible right ventricular hypertrophy, wrong, abnormal. That's correct. So no previous to compare with. So yeah, I mean, that's worthless to me. That's not even worth my time reading. That's why I just tear them off.
Yeah, no doubt. And so guys, I think there was a saying that the plaintiff attorney programs the software because they really don't want us to succeed. And the reason is because, let's take ventricular tachycardia, not that this is VTach, but ventricular tachycardia, for example, if you have a wide complex tachycardia, it's not always going to be VTach. It can be something like hyperkalemia, for example. So if it labeled it VTach and you shocked it, then the machine would be liable for you shocking a hyperkalemia. So they just have a very conservative read, and they don't have any of the big bad wolves programmed. This is one of them. So the clue that we actually do have is that there is something going on in V1 and V2. There is something going on. So if Michelle, do you want to come off mute and talk about how there's a catchy little thing Michelle uses for this?
Yes, this is one of my favorite things, and I have trouble remembering words sometimes when it doesn't match up with a picture. So in my world, I look in the V leads and I say, number one, nothing happens good in the V leads. And that looks cold in the V leads, cold in the V leads. And so I can remember BUR for Brugada's.
Hey, all right. So I love how you work through that. So Michelle's a very visual learner. And Tori just said it's cold in the V's. So in a nutshell, there is some ST elevation in V1 and V2. And this is a very high risk EKG because this patient did have Brugada's. So Brugada's is a channelopathy. And David, what should we know as providers about Brugada? What should our take home be?
So typically exercise and stress, fever, alcohol, things like this, it will typically bring this out, and that can trigger them going into a lethal rhythm. One of the things about Brugada, sometimes it's transient. So you have to catch the EKG while they're symptomatic. Sometimes it will be there permanent, sometimes it's transient, so it's hard to catch on a single trace, and you may have to get like a Holter monitor or something like that to catch it. There is some new treatments for it, so that's good. There's a few places around the country that's been testing out doing ablations. That's working. Medications are working. Hopefully they won't end up having to get pacers and things like that if you can catch this and treat it early. The problem with Brugada is genetic, so it's passing down family members, and that's why a close family member that died of an early sudden cardiac arrest early in their life is a big red flag for us. So you have to keep that in the back of your mind, regardless of the age of your patient, whether they're 10 or 50, it doesn't matter. They're now thinking what they were previously thinking was SIDS babies are being tied back to possibly being Brugada actually. So this is a very high risk finding, and none of your EKG interpretations are going to pick it up. I don't think any of them are actually programmed for them yet.
No, they're not. That's unfortunate. So here's the take home is that if you see the machine software say incomplete or complete right bundle, that should perk your eye. Be like, okay, I'm going to scrutinize this. And I'm going to show you a way that David taught us how to differentiate a right bundle from Brugada, because that can be difficult. And then, so if you just recognize that the V1 and V2 has ST elevation, and it's isolated and there's no reciprocal changes, meaning there's no ST depression anywhere, then that's significant for something called Brugadas. Okay, here's another example of it, and the machine will often read this as a STEMI, but you can see it's coved and there's ST segment elevation in V1 and V2, and those are the money leads. Okay, so V1 and V2. And here's the difference between the right bundle and the Brugada. So Michelle likes to say, because it's so cold in the V's, she can ski down the V's, and she likes this hill a lot better than this hill. And the difference is it all has to do with angles that are really specific, and we won't go into those tonight, but this is wider than the right bundle. So this is a lot wider. And David, don't you normally have like a pearl to share about something here with the Brugada complex?
To me, it looks like a sailboat, the sail of a sailboat, where you can see where the right bundle branch block, you got the R, then the S that falls down, then the big R, the big rabbit ear, and then you have a nice steep slope. Where in Brugada, you've got that flared out at the end of it. And that to me looks a little bit like the sail of a sailboat. So you got to be careful. Like I said, your computers are not programmed for Brugada. So what it many times we'll call this is a septal STEMI. So you got to watch out for that.
That's right. That's why the machine software, we don't trust it. So knowing these findings is huge. And this is that's how you spell it, Brugadas. So here's how to never miss this again. You're looking for right bundle branch block plus that weird ski slope ST elevation. You're looking hard at V1 through V3, and you're asking every time anybody who's had syncope, palpitations, chest pain, shortness of breath, dizziness, lightheaded, anything like that. Hey, have you had a family history? Anybody in your family died young, sudden death, and maybe you don't know why? Like if they got hit by a truck, okay, that's reasonable. But if it's, I don't know, they were just in their sleep and they died, or they were young, I don't know, right? This and they won't catch this on autopsy, which is the really scary thing, right, David?
Yeah, that's what makes finding this so hard. These are all, so Brugada will always show up. If it's there, it'll always show up in V1, V2, sometimes out to V3. We call those the right precordials. It will never show in any other contiguous lead or any other lead. If you see that pattern anywhere else, it is not Brugada. The reason why it's in the right precordials, it's because the sodium, the poisoned sodium channels are located over the right ventricular outflow tract. So only V1, V2, and sometimes V3 will pick it up. If you see that anywhere else, it's not Brugada.
All right, so Michelle just made a good point to pick your brain, because I think this is the only night we have you. So guys, don't be shy. If you want to come off mute, please do. So the case outcome for Kevin, he got diagnosed with Brugadas. So I'm just going to stop right here because I know that probably a lot of you have a question. Hey, if I see this in clinic, what should I do? So that's a hot potato patient, and it's going to depend on, are they symptomatic, right? It's going to depend on what your supervising doc or collaborating doc thinks. If you're on the ambulance, obviously you're going to transport, right? But if you're in primary and you spot this, that's going to probably be a discussion with your collaborating doc and see what they want to do. Mine would just be like, yeah, let's go to the ER. But a lot of them won't, right? But you know that if you're not getting them urgent follow-up, they do have a risk of going into cardiac arrest if they don't have an ICD. So these patients need ICDs. And unfortunately, even with an ICD, they can still go into cardiac arrest. So that's sad. We actually had a case local to where I live of a 26-year-old male. And his story was that he went to bed with a cold and he had a fever, and it was 2:15 a.m. and his wife noted he was snoring. You've heard this story many times, right? But she couldn't wake him up. And so she called 911. They walked him through CPR, or walked her through CPR. Ambulance got there. Ambulance resuscitated him, got pulses back, I think after 3 shocks. He was in VFib, got him to the hospital. His wife did such good CPR, instructed by the dispatcher, that she was able to keep him neurologically intact. And it's such a happy story. This hardly ever happens, as David knows, but he ended up getting discharged. It was about 10 days later with an ICD, discharged fully neurologically intact. and he's walking around doing amazing now, and still doing great. Knock on wood. But he's an amazing spokesperson for Brugada, and he actually did a year later, he did a reunion with the doctor that saved him in the ER, the paramedics that were there on scene that actually also saved him, like literally, and his wife who saved him. So in a nutshell, it's a really rare thing. It's a zebra. We look for zebras, but it's real, because if you see this and you miss it and you discharge them and they have a cardiac arrest and you were the last patient that, or last person that saw them, it's on you, right? And that's never a good position. So David, Amanda, who is one of our winners tonight, said, you're seeing both right bundle and ST elevation in V1 and V2. How can you see them both? Or is it that you're seeing only ST elevation in V1 and V2, and that's what Brugada's is? If you're seeing right bundle, it isn't Brugada. Are you able to answer that?
Yeah, so, okay. So Brugada will have the ST elevation, but the morphology of the STT segment looks like the sailboat. If you're actually having true ischemia, it won't have that pattern like that. It'll look more like a tombstone. If you have, so you can have a right bundle branch block with ST elevation, and that be a septal STEMI. Now, isolated septal STEMIs are pretty rare. It can happen, but it's really, really, really rare. Like it's like you would be lucky to see one in your entire career. So it's can you have ischemia and Brugada at the same time? That would be unlikely. And I think you would probably have to have an EP study to sort that out. I don't think by EKG alone, you would be able to sort that out. So for me, it's how they're appearing, and it's going to be the morphology of the STT segment. Like you see here, so on the left where the right bundle branch block is, that should always have a little bit of ST depression normally for right bundle. If you have a little bit of ST elevation with right bundle, that is concerning for a LAD occlusion. But you see the shape of it, it's still going to be the same shape. Over here in Brugada, that's going to look more like the sailboat, where it has massive ST elevation, but the shape is different. So that's without spending a whole hour on it, that's because that's what I normally do, is spend a whole hour on it. It's really going to be in the shape of the morphology, the ST segment.
And just to define morphology for any of you that are still learning, and I know we have some EMTs on here even, David, so super stoked about that. Morphology, in case you've never heard the term, is the shape of the wave. And so morphology is really important, as we talked about T waves, remember on night one, and you can go back and watch that replay. It's up in the guides section under day one. And if you're not sure where it is, we can tag you in it. But the shape of the waves is really important, as it turns out. So as you can see here, the morphology is like a sailboat. So this was a real high risk finding that hopefully you guys will never miss again. And I just wanted to tell you, we're going to do a giveaway tonight, but I wanted to tell you a little bit about the giveaway tomorrow night, because okay, I think I was confused with the slide that followed the photo. I misread it. Okay. Got it. No problem. Amanda, as Michelle said, we love the questions, so keep them coming. All right. So I wanted to tell you about tomorrow night, because tomorrow night is the big finale giveaway of our 30-day 30 EKG course that starts Monday. It's just like this, only you have a bunch more coaches. You have the amazing David, you have the amazing Michelle, and a bunch of other coaches too, along with more live classes just like this. But we spend a little bit more time on things, right? We go in deeper, we go in hands-on, and there's a lot more interaction. So we're going to be giving away tomorrow night a scholarship to that course. So David is one of our coaches that does something called study halls, and you'll get access to David's study hall. So David, what is your study hall about?
Oh, my study halls are about whatever you want to go over. So I don't use other people's presentations or PowerPoints. I usually take a few questions or people that have submitted EKGs over the week or two.
Mhm.
and then we just go through those. So you can give me whatever history you got. If you get the outcome, that's fine. What I'll do is I'll break down the EKG in detail. I blow it up. I point out all the little things. All of my classes are custom made I usually do them every other week. And of course, they're all recorded. So you can submit some, you can send them directly to me. You can just post them in the group, and then we'll go over it. Or if you don't have the EKG and just want to go over a topic, we'll spend an hour just going over nothing but that. And I'll show you lots of examples. And so you start picking up on the pattern recognition, how to see it.
Yep, and David has actually done study hall for a long time for us. So there's all the recordings from the last 2 years as well. Daryl, actually, Tori will put the link in for the 30-day. It depends on what position you are. Daryl, I believe you're PA. So for 6 months access to our whole live course, October, and then of the 6 months, it's for PAs. I believe it's $249. Tori will put the link. EMS has it for, I think, $199, and then students can get in if you don't need any CE for just $127. So it's a smoking deal, but we're going to give away one tomorrow. So I'm going to tell you about all the other things you get. Now, Coach Michelle, do you want to come on too and talk about the fun class you have lined up for this next 30-day?
For the 30-day, I am doing my basic class, which we divide up into at least 2 nights. And the first night we do very basic, like how every single lead in the EKG, I relate it to taking cameras. I use lots of visuals. I have a big heart. I actually have a skeleton that I show you, make sure where you put the EKG leads, but learning how to make what normal is in every single waveform, in every single lead across the heart. That way, when you see something different, you may not know what it is, but you know it's not normal. And then you look for sister leads, as we like to say, those contiguous leads, and then we need to see what's happening in the opposite lead or the reciprocal leads. So that's kind of, and then games, of course, lots of games.
Lots of games. So it'll be fun. It'll be fun. You'll have lots of information and it'll be fun. And then we're going to give away tomorrow night on the live, we're going to give away a spot to that. So you're going to get access to our 30-day EKG group. That's where David does his study halls. You're also going to get access to our more basic group called the EKG Launchpad, where you have everything basic. So you get basic and intermediate. And of course, you get one of those EKG kits mailed out to you. We have basically these classes that are for the CE base. So we go over real cases, we go over behind the scenes, how to work things out, hands-on EKG time with you, where we color code the EKGs, and then we record all the things. So this is also one of the things too. We've got stress testing behind the scenes of the cath lab. And then we have study halls, as David talked about. Here's David, you can see him. We also have Megan, Coach Megan, who does study halls as well. And then I do them too. So we all kind of cover different topics. We have lipid talks, we have sleep medicine talks, and then of course, all of these in our library as well. So tomorrow night's a night you really want to make it, and you get access to all these beautiful coaches. So we also have an EMS, we have 2 EMS folks in here who are brilliant, right? We have David and Sean, and then we have some nurse practitioners, Megan and Carissa and Whitney. And then we have Michelle, who's a long-term nurse. We have Gary, who's coming back on tonight to do a little bonanza for you, a little bonus class. And he also teaches in our 30-day. And then you also have me. And so without further ado, I'm going to go ahead and give you the hashtag for the winner tonight. Now, what we're giving away tonight, I wanted to show you. This is so cool. This is an EKG. Yay. Hopefully you can see it. So it's really nice when you have something that can lay over your EKG to help you figure out where the leads, what leads you're looking at. Contiguous leads, reciprocal changes. This is an overlay. So we didn't have access to these for a long time, but we actually have access to these again. So I'm going to be giving one of these away tonight, actually tomorrow, sorry, a few of these tomorrow, but you can actually get them. So if you want to order them, the nurse practitioner that makes them, she's selling them again. So just message me. And if you don't win one, you can get one from her. You will get one if you join the 30-day EKG challenge. It'll come in your box. So the hashtag for that is hashtag MI, because it stands for MI window. Hashtag MI. Okay. So type that in. We'll be giving it away tomorrow. I can see plenty of people in Zoom already put it, yay. And I just want to say a big thank you to everybody who asked questions and to Coach Michelle and David. You guys know that it's always an honor to be on screen with you, but an even bigger honor just to hang out with you and have you help our students. We're really grateful. So can we give a big 5-day EKG good night for Michelle and David, and give them a big hand for coming on? We're really grateful. So thank you. And if you're in the 30-day EKG challenge, you'll be seeing David for the next 6 months. And of course, sometimes he pops in the 5-day too when we're really lucky. But anyway, guys, we're going to come back in about 10 minutes for the live with Gary. He's going to do basic arrhythmias. And that one is the only session of the whole thing that will not be recorded. So any final thoughts, Michelle or David?
I
No.
don't have anything. David, you?
Ask all the questions.
Yeah.
Post EKGs, give the info you can, and we'll help you break them down. We'll help you read them.
Love it. All right, guys, we'll see you back on a different Zoom in just 10 minutes in the same group, and have a great night. Love you guys.
Bye.
Bye.